I am Dr. Gaurav Agarwal, Consultant Interventional Cardiologist from Narayana Multispeciality Hospital, Jessore Road, Kolkata. Today, we are here to demonstrate a case of a 63-year-old male who has presented to us with sudden onset chest pain from last 8 hours. Patient was found to have acute inferior wall MI, that is sudden onset heart attack on his ECG, and after taking proper consent and after explaining the entire procedure to the patient relatives, we have taken the patient for primary angiogram and angioplasty. Taking a puncture with this small needle at the wrist of the patient, and this is all what we need for doing the angiogram and angioplasty for this patient. You can see that through that needle we punctured the radial artery at the wrist of this patient, and we have introduced a very fine thin guide wire, and over this we'll put this sheath, and across this sheath the entire procedure of angiogram and angioplasty will be done. This is a 2 mm radial artery sheath which is called 6 French radial artery sheath, and through this we will proceed with the angiogram of the patient. This is all we need to achieve an access for a patient who is undergoing primary angiogram and angioplasty, and you can see with some minimal blood loss we have achieved a very good access to complete the entire procedure. So this is the coronary angiogram of the right coronary artery, which is showing that the initial part of the right coronary artery is more or less normal, but the mid to distal part is not seen, that is, it is totally occluded. It is totally blocked with a new onset thrombotic occlusion, and this is why the patient is having a heart attack. So if we open this artery up, then the chest pain of the patient and the heart attack of the patient will be resolved and the patient will be stable. Before proceeding with the angioplasty of the right coronary artery, we will show you the shoots of the left coronary artery. So you can see the initial part of the left coronary artery, that is the left main coronary artery, is normal, and it is bifurcating, dividing into two parts. The one which is coming towards us is the left circumflex artery, which is more or less normal except for a slight mild blockage in the initial part, and the other artery which is going to the other side, you can see that there is a very tight blockage. Now we have started with the angioplasty of the right coronary artery. We have engaged the right coronary artery with a 2 mm right coronary guide, and we have passed a very fine wire which is like a thread into the coronary artery of this patient, and you can see here that after crossing the wire we have achieved some minimal flow which was not there in the previous shoots, and the artery was occluded, but after passing the wire we have achieved some flow into this coronary artery. Now we have done a percutaneous transluminal angioplasty with a balloon of this right coronary artery. The size of the balloon was around 2 × 12 mm, and you can see the balloon inflating into the right coronary artery, and after doing the ballooning of this lesion we have found that there is a very tight stenosis in the mid segment of the right coronary artery. After doing the balloon angioplasty, we have passed a 4 × 36 mm stent across the mid segment of the right coronary artery, and you can see here the stent inflating into the coronary artery, and you will be very happy and surprised to see the result which we have achieved after doing stenting and post dilatation of this right coronary stent. You can see here that there was no flow in the, when we begin the procedure, there was no flow beyond the proximal part of the right coronary artery. Whereas now you can see that after doing the angioplasty of this right coronary artery with the balloon followed by stent, you can see the entire segment of the right coronary artery which is freely flowing with the dye and is almost as near normal. So this is how we do the primary angioplasty in patients who have sudden onset heart attack, and whenever there is a thrombotic occlusion of one of the major coronary arteries, we can address this by putting a balloon and a stent across the coronary artery and achieving a satisfactory result, which brings complete resolution of the chest pain and the heart attack of the patient. Thank you.